Hello, my name is Kayla Fisher, and today we'll be discussing the anti-inflammatory diet for pain management. This is part of the Aging and Integrative Pain Assessment and Management Initiative here in Northeast Florida. So as I said, my name is Kayla Fisher. I'm a registered dietitian, and I've worked at UF Health Jacksonville for almost 7 years now. I did my dietetic training at Mayo Clinic here in Jacksonville, and I work in an outpatient clinic providing medical nutrition therapy. So like I said, today we're going to talk about the anti-inflammatory diet and the role that it can have in managing pain. But we have to start with what is inflammation. So inflammation is our body's natural response and protection against many dangers like bacteria, irritants, trauma. Typically, it expresses itself as swelling, redness, heat, or pain. And over time, it can lead to long-term problems, as well as impact a number of chronic diseases, including chronic pain. Well, what is the role of lifestyle therapy? We know lifestyle therapy can include anything from stopping smoking, eating healthier, getting to a healthy body weight, physical activity, our sleep, and our stress. And focusing on these lifestyle therapies has also been shown to help improve chronic pain symptoms, especially back pain, inflammation, and our ability to move about through our day-to-day lives. A healthy diet can support weight loss and help manage pain. Physical activity or exercise also supports weight loss. If we're not active, that can make pain worse. So activity actually helps to decrease our pain. If we're carrying around excess weight, that can also increase pain as well as complicate other chronic diseases such as high blood pressure, high cholesterol. And research has shown there are proven changes we can make toward improving our pain and our overall health that are possible for everyone. So that's what we want to focus in on today. And that's where our diet comes in. Research has shown that an anti-inflammatory diet can absolutely reduce pain, inflammation, and stiffness caused by different conditions, especially arthritis and musculoskeletal pain. So what is an anti-inflammatory diet? Well, I want to be clear that even though we're using the term diet, it's not a diet in the way we often think of dieting, but we are calling this an anti-inflammatory diet in the sense that it's how we should be eating. It's an overall healthy eating pattern. An anti-inflammatory diet encourages whole foods, real foods, over processed foods or packaged foods. So think about something like eating a real apple instead of applesauce or apple juice. It's rich in plant foods. Those would be our fruits, vegetables, beans, nuts, whole grains, and healthy fats like avocado or olive oil. And it limits our added sugars, processed oils, red meat, and processed meats like bacon and sausage. There's many other health benefits besides just pain management. So an anti-inflammatory diet has also been shown to help control blood sugars, blood pressure, cholesterol levels, and overall health. Food can certainly have an impact on inflammation in our body, both in a positive way and a negative way. So we like to think of some of these foods as anti-inflammatory and some as pro-inflammatory. Pro-inflammatory foods are going to be foods that research has shown us worsen inflammation or trigger inflammation in the body. These are going to be sugar-sweetened beverages, and by that I mean sodas, juices, sweet tea, Gatorade, lemonade, fruit punch, any sugary drinks. Added sugars and refined carbs. So cookies, candies, cakes are sweets, as well as refined carbs like white bread, white crackers, chips, Cheetos, often those packaged convenient foods. Processed meats are considered pro-inflammatory and would include bacon, sausage, bologna, cold cuts, as well as solid fats, trans fats, and many of our processed vegetable oils. So these would be things like butters and margarines, as well as the soybean oil that shows up in most boxed and processed snack foods. Fried foods are certainly pro-inflammatory. We want to avoid those. And dairy has a question mark because it's a little bit controversial. We'll come back to that one later. Anti-inflammatory foods are going to be the foods that we just discussed eating more of. Vegetables, fruits, whole grains or intact grains, meaning things like oatmeal, brown rice, quinoa, as well as legumes or beans, nuts and seeds, healthy fats like olive oil or avocado, fresh herbs and spices, and plenty of water, making sure we stay hydrated. Here's a visual highlighting just a few of those really healthy anti-inflammatory foods, although there are more, as well as some of the pro-inflammatory foods at the bottom that we're going to want to eliminate or at least cut back on: fried foods, sodas, processed meats. So let's focus on a few key points. More fruits and vegetables. It is as simple as it sounds. We want to try to eat vegetables and fruits with every meal, aiming for 5 to 9 servings daily, which does sound like a lot. Keep in mind that some large pieces of fruit would count as 2 servings. Fresh or frozen fruits and vegetables would be ideal when that's possible, but we have to be realistic. So if we do need to do some canned vegetables, the best thing I can recommend is look for the ones that are low sodium or salt-free. You can also rinse those off before you eat them or cook them to decrease the sodium intake. So fresh or frozen when we can. These fruits and veggies provide antioxidants, fiber, as well as vitamins and minerals to our body. If we want to know the best fruits and vegetables for an anti-inflammatory diet, we want to focus in on leafy greens like spinach. Broccoli is a great one, and then berries. Next, we want to make sure we're consuming healthy fats. You might have heard of omega-3 fatty acids. So these are one of our healthy fats. Our healthy fats are unsaturated fats. So these are things like olive oil, nuts and seeds, avocado, chia, and flax seeds. Our unsaturated fats tend to come from plant foods, and they've been shown to have many benefits, both to reduce inflammation, but also to keep our heart healthy. So not all fat is bad. It's the type of fat that matters. Our saturated fats have been shown to promote inflammation. So these are the ones we want to limit or avoid. Saturated fats are solid fats at room temperature, like butter. They tend to come from animal fats. So whole milk, ice cream, butter, the fat that's in red meat, the fat that cooks off of like beef when you cook it, bacon, sausage, processed meats. This is a reason we want to avoid them. And then we want to limit our use of vegetable oils like soybean oil. We won't go into all the research for today's presentation, but there's some research to show that if we're consuming too many of those processed vegetable oils, which provide omega-6 fatty acids, and we're not consuming enough omega-3 fatty acids, the ratio gets thrown off, and the wrong ratio can promote inflammation. So the takeaway message is to focus on the omega-3 fatty acids, healthy plant fats, and try to limit the processed foods in general. Choose whole grains. So whole grains or intact grains are going to be less processed. This means that they maintain more of their fiber and other nutrients like important minerals. Whole grains would be foods like oatmeal, quinoa, brown rice, whole grain bread or crackers if you are going to consume those, whole grain pastas. I always like to mention, depending on your other health conditions, the portions you should consume of these foods or the frequency could vary. So someone who has diabetes may need to be a little more mindful of the grains they consume compared to someone who does not. So just please keep that in mind when you listen to today's presentation, that it's not specific to your own individual medical history, but just addressing general healthy eating as part of an anti-inflammatory diet. Okay. Okay, so then the grains and starches we want to avoid are going to be the refined ones. And by refined, we usually mean highly processed, which takes away some of the fiber and nutrients. So these are things like white breads, biscuits, pastries, bagels, chips, crackers, muffins, baked goods, sugary cereals, white rice, white pasta. There's a lot of them. And I highly recommend that we cut them out or cut way back. You may be surprised at the impact that this category has on your pain as part of an anti-inflammatory diet. The typical American diet is certainly consuming too many of these refined grains and starches. As part of that, we recommend that you avoid added sugars. So notice that we do draw a distinction between added sugars and naturally occurring sugars. Some foods like fruits that are healthy foods do have natural sugars in them. And those impact our body very differently than some of these added sugars we're consuming in such excessive amounts. So whenever you look at a food label, pay attention. Most of the newer food labels will show you the difference between added sugars and the sugars that are already in the foods. It's the added sugars that we really want to target and cut back on as part of an anti-inflammatory diet. Too much sugar can contribute to inflammation and obesity, which are very connected in many people's bodies. So cutting back on sugar drinks, soda, juice, sweet tea, sports drinks, lemonades, cookies, candies, cakes, ice cream, all those sweet foods will certainly help here. But I do encourage you to read those food labels, because some other foods, such as granola bars, that we think of as healthy foods, tend to have quite a bit of added sugar. So look at those food labels. Keep in mind, when some foods are made to be low sugar foods, fat-free foods, a lot of the labels that we'll see promoting health, often whatever is taken out is just replaced with something else. So sometimes our sugar-free foods will have artificial sweeteners instead. Sometimes our fat-free foods will have more sugar added to maintain the taste, which is one of the reasons that the anti-inflammatory diet doesn't focus as specifically on these nutrients on a food label as a general pattern of eating that focuses on whole, real foods like fruits, vegetables, beans, nuts, whole grains, and really encourages us to limit the processed foods. The processed foods, frozen meals, frozen TV dinners, cookies, chips, candies, and cakes are where we find the sugar, the processed fats, the sodium all together. So I like to reinforce that. It's one of my number one takeaways. If we avoid the processed foods, a lot of this fixes itself. Okay, a couple more things we want to touch on. So less red meat or processed meats. These also have been shown to be pro-inflammatory. So we want to avoid or limit, at least cut back on red meat like beef and burgers, processed meats like bacon, sausage, corn dogs, bologna, cold cuts. Try to avoid or limit your fried meats. Instead, we should focus on healthier, leaner proteins such as fish, especially fatty fish like salmon, get those omega-3s in, skinless chicken, eggs, and then also plant proteins like beans, nuts, peanut butter, tofu. These can be excellent sources of protein that are also anti-inflammatory, or at least don't promote the inflammation in the body. So let's come back to dairy. Dairy is a little bit controversial. There's research that you can interpret both ways. So some suggest avoiding it, while others would say it's a nutritious food group. My recommendation is that you certainly avoid dairy that is high in fat or sugar, such as whole milk, ice cream, cream cheese. However, I do think that dairy that provides us protein and probiotics, such as Greek yogurt or low-fat cottage cheese, can certainly be included in an anti-inflammatory diet. For many people, this is a great way to get in probiotics, which actually help us keep a healthy gut or a healthy microbiome, which also plays an important role in controlling inflammation in the body. To kind of bring this all together for us, if you're looking for a specific diet or eating pattern to follow that is anti-inflammatory, I'd recommend you look more into the Mediterranean diet. The Mediterranean diet is proven to be one of the healthiest diets we know of, both for the prevention of chronic disease as well as the management of chronic disease. It is certainly anti-inflammatory. The way that the Mediterranean diet works, if you look at this food pyramid in front of you, is the foods that are in the bottom of the pyramid are the foods we should be eating the most of. So these are plant foods: fruits, vegetables, whole grains, olive oil, beans, nuts, legumes, and seeds. These foods should be incorporated into every single meal we eat. Add a fruit, add some vegetables, use beans as your protein. That should be the majority of our diet. The next step up is fish and seafood. So remember, try to eat fish more often. Try not to fry it. Focus on those healthy fats that we get from some of our fatty fish. The next step up the pyramid incorporates lean chicken, poultry, eggs, and yogurt. So we can have these in moderate amounts, maybe once daily. That could be an egg with breakfast. That could be chicken for dinner, maybe Greek yogurt as a snack. And you'll see up at the very top of the pyramid, it says less often. So this is red meat and sweets. Just as we've discussed with the anti-inflammatory diet, the Mediterranean diet is very limited in the amount of red meat, sweets, and added sugars we consume. You can absolutely avoid these completely if that's something that feels doable for you. And finally, you'll notice that the Mediterranean diet is built upon a foundation of physical activity. We have to talk about physical activity as part of lifestyle therapy because physical activity helps maintain health in our body, and it's also been shown to help manage pain. So, as I said, research shows physical activity can manage many health conditions. It's been shown to decrease pain for those with osteoarthritis, improve many chronic diseases, can also improve flexibility, healing, and reduce stiffness. How do we get in more activity? Whether you like to think of it as just moving more, being more active, or exercising, we do encourage you to make it a priority to get daily movement. We typically recommend that you start with a goal, ultimately, that your goal be getting up to at least 30 minutes a day, but we want you to start wherever you are. If that's 5 minutes a day, start there and build up. Keep in mind, your exercise can be broken down into many workouts. So you could do a 10-minute walk in the morning, a 10-minute walk at lunch, and a 10-minute walk in the evening, and still achieve that goal of 30 minutes of activity a day. Just look for small, fun, creative ways to add more movement. So walking a dog, going for a walk with a friend, walking during commercials of your favorite TV show. You can try a new form of exercise, something like yoga or Tai Chi. I often encourage my patients to check YouTube for free exercise videos. If you like dance exercise, if you like stretching, if you want a group to do it with, there are many groups out there. If you have Medicare, you can access their Silver Sneakers benefit. So there's a lot of ways to do this. It does not have to be traditional exercise or going to a gym, but we do want to encourage you to think of ways to start increasing your daily movement, as that plays a very important role, both in your general health, but also to manage pain and incorporate that as part of a Mediterranean or anti-inflammatory diet. That's our conclusion for what we would talk about today. Lifestyle therapy can, of course, encompass other topics, such as getting enough sleep or managing stress. Today, we've really focused in on the anti-inflammatory diet and physical activity. If this presentation has brought up questions for you, feel free to reach out to your coordinator or someone involved with the program, and we'll be happy to get you those answers. Otherwise, we wish you all the best.